everyone, welcome back to my channel. It's your girl Leisha B, and I am back with another video for you guys today. In today's video, I'll be showing you guys common abbreviations that we nurses and nursing students as well will be using when we get into practice. So, disclaimer. When we use these abbreviations, make sure that you are allowed to use it. So you must check your policy, you must check your institution, because not every abbreviation is used on every unit and every institution. So make sure you check your policy to make sure that these abbreviations are acceptable. Okay? With that being said, if you're new, welcome to my channel. Don't forget to hit that subscribe button down below and the post notification bell. That way you're notified every single time I post another hit video. And without further ado, darlings, let's get right into the video. Alright guys, so we're going to start off with our abbreviations for med times and order frequencies. Now remember what I said, make sure that you're allowed to use these abbreviations on your unit. You just have to check the policy because sometimes these abbreviations can mean something else and they could be mistaken for that, and then you could get a med error, and we don't want that to happen at all. So make sure you check your policy before you use these abbreviations. So let's begin. When you see orders that contain Q2H, this just means every 2 hours. Every 2 hours. Okay? When you see Q4H, same thing, but it just means 4 hours. Q12H, like you guessed it, every 12 hours. So you might see an order that says check vital signs Q2H, or check blood sugar Q4H, or check vital signs Q12H. Stuff like that, that's where you will see the frequency. Now for BID, BID means twice or 2 times per day. TID means 3 times per day, and QID means 4 times per day. So that's again another way of giving frequency. So stat, we know that stat means immediately. So stat may be for an order of pain medication or insulin. Say for instance that your patient is experiencing severe pain and they don't have an order for hydromorphone. You may call the doctor, do S-bar, and the doctor might say, okay, give 10 milliliters of dilaudid stats. Or they might say, hey doc, my patient blood sugar is 20, what do you want me to do? He might say, okay, you could give 4 units of Humalog stats, and that's where you'll see that word. Okay? PRN means as needed, or sometimes you call it breakthrough. Okay, so that literally means PRN as needed. So say for instance your patient got 325 mg of acetaminophen, and that was the scheduled dose, and your patient is still in pain. The doctor may prescribe PRN 325 or 650 as needed. So your patient will need that because he's still in pain. So that's when you will give them that medication. So that's when that's what PRN means. Now, ad lib, this one I don't think is as common, but it means as much as patient desires or tolerates. So I used to work on a rehab unit, and we will also have to like ambulate patients, make sure they're walking, get out of bed, but it will be ad lib, as much as the patient desires or tolerates, because again, they're in pain, they're recovering. So this is what you'll see on orders. Get patient out of bed 3 times a day, ad lib, and you'll try to get them out for meals, and if they're not able to, you can keep them in bed, and that's how you will dictate the ad lib. So these next 2, AC and PC, you want to make sure that your agency or your institution uses these 2 because they're not really as common. But AC just means before meals, and PC means after meals. So you want to make sure that the medication that has AC and PC on it, you give it at the right time to avoid any medication errors. Now HS means bedtime, and Q, like we said before, means every. Okay, so HS, bedtime, you could see Lantus or any long-acting medication. It could be given either during the morning or at bedtime HS. So that's where you'll see that. And Q, like I said, is frequency, Q2H, Q4H, Q12H, and so forth. So next we are going to go into the medication administration routes. These ones, as nurses, you will have to know because basically all the doctors write their orders in these shorthand. So make sure you just know these for reference and to make sure that you're not doing a medication error by giving it in the wrong route. So for the first one, IM, this one is intramuscular. So you want to make sure that you are, So you want to make sure that you give your intramuscular medication at a 90-degree angle, okay? That's how you give intramuscular medication, and some of them might include vaccinations. We know that those are given IM. Antibiotics are sometimes given IM, and vitamins are sometimes given IM as well. So we want to make sure that you look at the doctor's orders and make sure that you see that administration route. Next, you'll see sub-Q or SQ. This just means subcutaneous, okay? Subcutaneous. And you want to make sure that you give these medications at a 45-degree angle, okay? Some sub-Q medications might be pain medications. A most common one for sure is insulin and some hormone medications. So you want to make sure that whenever you see sub-Q, you give it at a 45-degree angle and you make sure that you give it correctly. Next one is PO. And this one is obviously by mouth. And you just give pills by mouth. You can give cough syrups by mouth. So you just want to make sure that whatever medication it is by mouth, PO. And you want to make sure also that it's not SL. If it's SL, which means sublingual, you want to make sure that the patient puts the pills underneath their tongue and not swallow it, or you don't crush it. Alright, so I basically already told you guys what SL means, and that just means sublingual. Lingual meaning tongue, so it's going to be underneath the tongue, okay? So medication that could be given sublingual is melatonin. You will also give nitroglycerin underneath the tongue. You guys know the 3 rules for that, the 3-step rules for that. That's the next medication that you'll give sublingual as well. So NPO means nothing by mouth. So you will see this if a patient's getting ready for a surgery or they are having a hard time eating and swallowing, so that way they're aspirating. You will see NPO, and that means nothing by mouth. No water, no meds, no foods, nothing. If you see BUCC, that just means the buccal, which is cheeks. So this is some type of medication that you'll put between your cheeks and your teeth, just that little space right there. And it could go from mouthwashes to sprays to chewing gums to bioadhesive tablets, stuff like that. And the reason why we don't chew them or swallow them is because we want them to dissolve and go into our bloodstream faster and quicker. So that's the reason why we put it in the mouth and just let it dissolve without any chewing and any swallowing. The next route is ID, and this one is intradermal, and that just means right underneath the skin. So when you're giving medications like this, you want to give it at a 10 to 15 degree angle, okay? And medications that we give intradermally, the most common one is TB, okay? And this one takes the longest to absorb. So you want to make sure that you give intradermal medications at a 10 to 15 degree angle. Next is transdermal, TD. And this medication is just given on the skin. It can mean creams, it can mean patches. And some examples of this is opioids. It could be Butran patches, it could be nicotine, it could be fentanyl, it could be estrogen and testosterone patches. Those are the type of medication that you'll give intradermally. And INH is inhalation or inhaler. And obviously these ones will be most common for people who have asthma. You could give them their Spirivas or their Flovent or their, which other one? Alvesco. So stuff like that is what you would give inhaled, okay? Now IV, this means intravenous, okay? And this means in the vein. Now, medication that you give IV, these are very important because it is the fastest way a person will get the medication. So you have to make sure that the medication that you are given is the right medication, the right dose, the right person, and you check off all your medication administration checklists and do your checks for the patient as well. IVPB, this just means intravenous piggyback. Okay, and medications that you'll give are antibiotics. You'll definitely give antibiotics piggyback. You can also give opioids piggyback as well. Now, you want to be careful with IV push medications because this is one of the fastest ways that your patient gets medication. You're pushing that medication directly into their bloodstream. And that is all I have for you guys today. This is all the nursing abbreviations that are most likely to be used on your unit. Again, make sure you check your policy before you use these abbreviations because some of them may not be considered best practice on your unit. So you want to make sure that you are not creating any medication order errors or any medication errors in general, okay? Thank you guys for watching. I love you guys so much, and I'll see you guys in the next video. Bye!